Hello, Rancho Cordova residents and businesses. I'm Rancho Cordova City Council member David Sander, and I'm also a virologist, a scientist specializing in the study of viruses. Sacramento County Public Health, healthcare networks, and pharmacies are continuing to vaccinate people to safely protect them from COVID-19, beginning with those who have the highest risk. Many of us have questions about COVID-19 vaccines, but it's difficult to know what information is factual. So we've created a 4-part video series to help answer your questions. In part 2, we'll provide you with helpful information on getting the COVID-19 vaccine. Let's get started. We know it's confusing. We have broken down the process for getting a COVID-19 vaccine into 3 simple steps. 1, find out if you're eligible to receive the vaccine. Vaccine supplies are limited right now, so the vaccine is being provided in phases, beginning with those with the highest risk, including people 65 years old and older, healthcare and congregate care workers, and first responders. Visit Sacramento County's website for more detailed information. Step 2, if you're eligible to receive a vaccine, you can contact a few different resources for availability. Check with your healthcare provider and local pharmacies. Start with their websites for information. Links are available on the city's coronavirus webpage. If you are a healthcare worker, check with your employer or contact Sacramento County Public Health through its website. If you are 65 years or older, Sacramento County is now offering appointments first come, first serve. Make an appointment online. If you need assistance, ask a trusted family member or a friend to help you make that appointment. Education and childcare workers, emergency service workers, food and agricultural workers can also sign up to receive email updates about future Sacramento County hosted vaccination clinics. Step 3, if you aren't eligible yet to receive a COVID-19 vaccine, sign up to find out when it's your turn. The state has launched a new app called My Turn, where you can find out when it's your turn to get vaccinated. Yes, due to the severe health risks associated with COVID-19 and that it is possible to get reinfected, at least it might be possible to be reinfected, you should be vaccinated regardless of whether you've already had COVID-19 or not. However, if you were treated for COVID-19, talk to your doctor first about getting vaccinated. Some COVID-19 treatments require you to wait 90 days before you get that vaccine. Yes, during the February 1st, 2021 press briefing by the White House COVID-19 response team and public health officials, Dr. Anthony Fauci discussed why Americans should get the current COVID-19 vaccines now, even with the variant circulating, instead of waiting for the next generation of vaccines.
And the reason for that is that there is a fact that permeates virology, and that is that viruses cannot mutate if they don't replicate. And if you stop their replication by vaccinating widely and not giving the virus an open playing field to continue to respond to the pressures that you put on it, you will not get mutations.
Wear a mask, wash your hands, and social distance. The Centers for Disease Control, or CDC, tell us that masks protect both you and others from airborne droplets, which is how the virus is spread, as does washing your hands frequently and staying at least 6 feet from others. Avoid gatherings. Contact tracing data shows us that gatherings are the main source of recent outbreaks, and we know it's tough, but these small sacrifices will help save lives. If you suspect you have COVID-19, get a free test. This helps identify others who may have been exposed to the virus, which helps stop the spread of the virus. Do you have more questions about COVID-19 vaccines? Type them into the comment section below, right down there. Visit the city's webpage for even more information about COVID-19 vaccines, or call City Hall if you don't have access to a computer. We can help slow the surge, Rancho Cordova, but we can do it only if we work together.